Hi everyone, I'm Dr. Geyer. Welcome to my YouTube channel, and this is Marianne Mitchell. She's the health coach that I collaborate with. I want to give you a little bit of background before we launch into this. This will be our new SIBO series. Yes. I've been treating SIBO for over 6 years now, and really it's become a niche of mine over the past 6 years. And during this time, it has been a really interesting evolution of testing, treatments, our understanding of it, of this very vague diagnosis. So we're going to try and address a lot of that. But what I wanted to talk about is, at a certain point with the treatment, I felt really limited in what I was doing. There was the part of the treatment that I was doing, and then there was the second part of the treatment, which is diet.
Yes.
And I was running into this wall of leading people through the diet portion, which is super, super important for not just treating SIBO, but healing up the gut. And that's when I approached Marianne and asked her if she would develop a program and develop the diet for my patients. And we've been working together for months on this. So we're really excited to start busting myths and giving people back hope that this is not a diagnosis you're going to have the rest of your life.
It's definitely, there's so many myths out there around the diet and having to be on it long term and the approach of it and just everything, and it just breaks our heart because people feel so limited for so long when it's completely unnecessary. So we are going to be diving into what SIBO is, the symptoms, and why testing is important. So I say let's get started.
All right. So SIBO is an acronym. It stands for Small Intestine Bacterial Overgrowth. This is super important because we're only talking about the small intestine. We're not talking about the large intestine. We're not talking about fungal infections. We're talking about bacteria that grow in the gut, very specific types, and they produce gases. And these gases are what are damaging and what cause a lot of the symptoms that people associate with SIBO.
Yeah. And so the complicated thing is that a lot of the symptoms can be related to a lot of different things. And we have things like, okay, let's talk about the first most common ones, which is burping after meals. We have heartburn or GERD. We have things like bloating. And we're not talking like a little bit. Like you wake up with a flat stomach, and by the time you're going to bed, you look pregnant. Some people look up to 6 months pregnant, completely distended. It's painful. You get super nauseous after meals, or maybe you just have a low-grade constant nausea and no doctors can explain it, and they want to put you on like antidepressants or something. Diarrhea, constipation, or the alternating of the two.
So it's hard to make a SIBO diagnosis. It's hard to even think SIBO as a doctor without having gut symptoms. Patients absolutely come in without gut symptoms, but most often there are these gut symptoms. I would say the number one is the bloating, where again, you feel like you're normal size in the morning and then you feel like you're just pregnant by the end of the day. Sometimes that is almost miscorrelated with food sensitivity, which can also cause this, but it's very reliable for people, where they wake up, they feel, okay, I look fine, they put something on, and then by the end of the day, they're super, super bloated. And then these bowel changes are pretty reliable, meaning not that they'll be consistent that way, but that somebody will have constipation most of the time, or they'll have diarrhea most of the time, or they'll have alternating, and it's just, they'll say, I never have 2 stools that are the same.
Yeah, all right. But then we start getting into some more obscure symptoms, including abdominal pain, just random pain. But then we're talking sleep changes, like insomnia, chronic insomnia, and you take everything for it and it's just not getting better. Mood changes, especially anxiety, and then heart palpitations. So you go to the doctor because your heart feels weird and you're like, this is freaking me out, and your heart's fine. It can completely be related to SIBO, which is pretty crazy to think that your intestines can affect your heart, but they do. Leaky gut, fibromyalgia is actually, SIBO can be a root cause of that systemic pain throughout the body. And then you have random rashes, including acne and rosacea, chronic fatigue. Your doctor treats you for candida and it doesn't work. Then it might actually not be a fungal infection, but a bacterial one.
Yeah. Your body only has so many ways to say it's sick, so it covers a lot of different symptoms, which can be very confusing. And I have to say, a lot of my colleagues and a lot of physicians that I know, they think SIBO and they want to run. They're like, I don't know. I mean, abdominal symptoms is like, it could be anything, or these really vague symptoms. But it's actually not that vague when it comes to SIBO. It makes a lot of sense.
It does, if you know what you're looking for,
Mm-hmm.
right?
Mm-hmm.
And there's three more things that are very common with SIBO, which is, let's say you take a probiotic, or you start consuming probiotic-rich foods like kombucha or sauerkraut, and they make you nauseous. Everybody else eats them. They're like, oh, this is the best thing ever. You hear in the news, like, you need probiotics. Like, we're finding all this great information, and we are. But for you, you're super sick. Like, you're just like, you take it and you are down for the count for the rest of the day because you're so nauseous. Unexplained nutritional deficiencies, specifically anemia. It was really interesting when you were telling me about that.
Yeah, so SIBO consumes B12 and iron, and I'll have patients come in and they'll say, well, I've always been anemic, and they don't have a bleeding issue, they don't have any chronic disease where there's anemia involved in it, or that's the cause. And I think to myself, okay, well, now you've got gas, you've got this, and I'm kind of putting this picture together. B12 and iron are two very, very big ones. Or they say, I just can't take the iron supplements because they make me really sick. And that's another key thing that we hear. There are other nutritional deficiencies that come along with this, like magnesium and some other ones, but those are two big ones.
Yeah. So our big thing is don't guess, take a test.
Always. Yeah, I mean, I hear this one a lot as well, where people say, well, can't we just treat empirically? Or someone tested me in the past. And here's the thing, everyone is going to look very different. So I've had people come in that are totally convinced that they have SIBO, and it comes out negative. So not everybody has SIBO. That's an argument I heard from another physician last year. I was like, that's not true. I can tell you that's not true. But the other piece is because there are different types of bacteria, and there are many bacteria involved in small intestine bacterial overgrowth, and they produce hydrogen, they produce methane, they produce hydrogen sulfide. And so we need to know what we're treating, and we need to know what the levels are. If somebody's at a 22 combined versus 147 combined, that's very, very different. If somebody has methane producing bacteria but doesn't have hydrogen, those are different treatment options that we're going to go through. So we need to know what we're treating and what the options are, and then a very realistic timeline, because what I want to do is completely cure them of SIBO, not SIBO for the rest of their lives, and then heal up their gut, which is where Marianne and I work together.
Yeah, you should not be living a low FODMAP or SCD lifestyle forever. Those are great therapeutic diets, and they have their place, but they're not lifestyles. They are temporary diets. They're supposed to help heal up the gut so then you can return to a normal, healthy lifestyle, not a normal American diet, but a healthy lifestyle. And so when it's treated correctly and you heal the gut after we get back to zero, we get back to healthy, then you're able to live the life that you want to live and do the things that you want to do and feel good. And so we are very excited because we have a special offer for you. We are giving you $10 off of a SIBO test, and all you have to do is go click a button, pay, it'll show up in your mailbox, follow the instructions, send it back, and you will know if you have SIBO or not. So if you feel like, oh my gosh, like I feel like there's a light at the end of the tunnel, this is so me, then make sure you take a test. We are here for you, and we are able to offer you treatment after you get your results. So stay tuned. We have a lot more coming your way.
We do. And if you know anyone who has these symptoms that might benefit from this video, please share it, because ultimately all we want to do is make sure people get their lives back.
Yes.
Thank you so much, and keep your eye out for more videos. We can't wait to see you next time. Bye.